So actually, I will discuss a broad spectrum of secondary prevention programs and also our own trial, and also with a very, very different intensity of secondary prevention support programs. That starts with programs such as the Stop Stroke program in the UK, in London, where they tried to examine whether just information actually provided to patients, to caregivers, and to general practitioners would improve secondary prevention. They actually examined whether the prevention targets, so adherence to the targets and control of risk factors, would actually improve with such an information program, and actually they did not find any difference. And there are other programs that also are a little bit more interactive. So there have been studies in China, also in Australia, and actually with very, very modest effects on risk factor control and target adherence. So we did actually probably the most intensive program with up to 8 outpatient appointments of post-stroke patients, with so feedback strategies based on motivational interviewing, with measuring the risk factors, and actually then finally trying to agree with the patients on the most important measurements. And so the good news is that actually with more than 2,000 participants in this study, we obviously were able to improve the quality of secondary prevention when it comes to improved risk factor controls of blood pressure, cholesterol, atrial, oral anticoagulation, atrial fibrillation patients, and so on. And so we had significant improvements on this side. Unfortunately, this did not translate to fewer recurrent events. So with so we call them major vascular events, and that includes stroke, acute coronary syndrome, and vascular death. And unfortunately, we did not see a significant difference. And it may be actually that as we included all patients with risk factors, but not only patients who did not have satisfactory control of the risk factors at around 1 week after stroke, maybe that we had a dilution of the effects because many of the patients had almost perfect control of their risk factors anyway. The other thing is that as it was a randomized control study with patient randomization on patient level, we sent many patients of the control group to the same family doctors, general practitioners, as those patients who were in the intervention arm. And therefore, the family doctors tried to provide optimal treatment also for the control patients. So we might have a bias by better treatment in the control arm. There are 2 interesting studies from Austria and from New Zealand. They actually had either a single appointment intervention or a 2-appointment intervention. And when they look at outcomes at 1 year, actually both had improved quality of life and decreased dependency. And the Austrian study also showed a reduction in recurrent events with a less intensive intervention. On the other hand, when we look at the Kaplan-Meier curves of the events, actually the 2 groups already divided earlier, so before they did the intervention after 3 months after stroke. So it's a little bit unclear, and they did not show any improvement or in risk factor control or secondary prevention targets at 1 year. So I think these studies need replication and need confirmation by other studies, but this is just the overview of the currently available studies.